Welcome to the Allura Home Health Vlog. This is a spot where you can get thought leadership, information on topics that matter to your agency today.
Today, we're laser focused on a really critical challenge for anyone in the home health space. How to not just keep the amazing caregivers you have, but also, attract more.
Mm-hmm. It's a big topic. And the reports are pretty consistent, aren't they? Non-competitive wages, feeling overworked.
Exactly. And seeing, frankly, more attractive options elsewhere. It's a real dream.
It really is. It hits agencies hard, impacts patient care consistency. It affects everyone, really.
Absolutely. So for this deep dive, our mission is, well, to cut through the noise. We want to pull out those key foundational strategies, things that any home care agency, regardless of size or budget, can actually start implementing.
Core principles, because while the specifics might vary agency to agency, these fundamentals, they apply across the board.
Right. And you'll see, I think, how these things connect. Invest in your current team, make it a good place to work, and recruitment gets easier. It's a synergy.
Definitely. It all feeds into each other.
So the source material we looked at highlights four foundational areas to really get a handle on turnover. First one, ensuring adequate paid training.
Yes, that's crucial. Think about it. When someone starts and they feel properly oriented, they know exactly what's expected. They feel set up to succeed.
Not just thrown in.
Exactly.
Yeah.
It helps with compliance, sure, but it massively boosts their satisfaction right from the get-go. Confidence is key.
Okay, but it's more than just that first week, isn't it? The source also talks about upskilling, teaching new skills. Why is that so important here?
Yeah, upskilling. It's interesting because it works on two levels. For the agency, you get a more skilled, more flexible workforce.
Makes sense.
But for the caregiver, it's about growth, feeling invested in,
Sure.
seeing a career path, not just a job. And that makes your agency way more attractive when you're recruiting.
So you can actually sell that. Come here, we'll help you grow your skills.
Precisely. If you can genuinely highlight the training, the skills, the experience you offer, that gives you a real edge over competitors just talking about pay.
Okay, that's a strong point. Foundational area number 2, investing in human resources properly.
Yeah, and not just seeing HR as like the paperwork department. The source really emphasizes needing to resource them properly financially too for recruiting, hiring, training, retention efforts. The whole package.
So empowering HR to be more strategic.
Exactly. When HR can actually focus on things like improving morale, giving real feedback and support, making that onboarding time really count, you see job satisfaction go up and turnover goes down.
It sends a message, doesn't it, that the people matter.
It absolutely does. It tells your team their value, their well-being is a priority. Simple, but powerful.
Okay, let's hit the third area, creating a culture of support and communication. Seems obvious, maybe.
You'd think so, but in the day-to-day chaos, it can get lost. Feeling heard, feeling like your concerns actually matter. It's fundamental to job satisfaction. Open communication builds trust, stops small issues becoming big ones.
And the source suggests practical ways like frequent feedback, staff surveys, appraisals, things like that.
Yeah, taking the pulse regularly. Surveys give you insight into what caregivers are actually experiencing out there. What are the challenges? Where do they need more support? It shows you care enough to ask.
Right. And it's relatively low cost to get that kind of feedback loop going.
But there was a caution, too, about relying too much on exit surveys.
Yeah. Why was that?
Well, the thinking is someone who's already decided to leave, they might not be super invested in giving, really constructive feedback to help the people still there. Their focus has shifted.
Okay, I see. So their input might be useful, but maybe not the most reliable for fixing things now.
Potentially, yeah. Better to focus on listening to the people who are still committed.
Makes sense. All right, fourth foundational area for retention, providing the right tools. Seems basic, but how big a deal is this?
It can be huge. Think about the daily grind. Having the right tools and good tech, like decent EMR software that isn't a nightmare to use it, just eases the burden. Streamlines paperwork, improves communication, makes the job less frustrating.
Less admin hassle, more time for actual care.
That's the goal. And the source mentioned a big provider that cut turnover, partly by focusing on quality and specifically better software, boosted productivity, profitability, but probably also just made life easier for the staff.
Right. So investing in tools isn't just an expense. It's an investment in your people and efficiency.
Exactly. It encourages listeners, agency leaders, to really look objectively. Are current tools and processes helping or hindering our caregivers? Where can we improve?
Good prompt. So those are the 4 pillars for keeping the team you have. But then you need to bring new people in. Recruitment.
Yep. After retention comes attraction.
And the source breaks recruitment down into 3 main buckets: looking inside, looking to the community, and looking online. Let's start with looking inside. What does that mean?
Basically tapping into your current team. Your employees are your best ambassadors, right? So employee referral programs. Incentivizing your staff to bring in good people they know.
Because they know the culture, they know the work.
Exactly. They're likely to refer people who are qualified and will actually fit in. Plus, it takes some pressure off the recruitment team.
And potentially reaches people who aren't even actively looking for a job, right? Passive candidates.
That's a huge benefit. Someone might not be scrolling job boards, but if a friend they trust says, hey, you should check out where I work.
Yeah, that's powerful. What kind of incentives work best for these programs? The source mentioned a few ideas.
Yeah, it's not just cash, though that's often popular. Prizes, recognition like shout-outs on social media or in newsletters, gift cards, tickets to things. The key is making it appealing and clear.
Makes sense. Okay, so that's looking inward. What about looking to the community? Where do agencies look locally?
Building local ties. A big one is partnering with nursing or CNA programs nearby. They often need clinical sites for their students.
Ah, a win-win. Students get experience, the agency gets early access to potential hires.
Exactly. Offer contracts or stipends for students to work alongside your staff. If they have a good experience, guess where they might apply after graduation?
Right, builds a pipeline.
And the source suggests hosting like end-of-semester meetings with these students. Get feedback, but also sell the agency. Talk about open jobs, pay, benefits, the support, the impact they can make.
Smart, catch them early, show them why you're a good choice. Okay, finally, looking online. Can't ignore that these days.
Absolutely not. You need an effective online presence to reach a wider audience. The source even used the term recruitment marketing. It's more active than just having a website.
Recruitment marketing. Okay,
Right.
So what does that involve beyond just job listings?
Things like monitoring and responding to online comments shows you're engaged. Starting a company blog builds trust, shows expertise, showcases your culture. And sharing positive stories, patient feedback, staff spotlights, that's powerful social proof.
Real stories from real people. That resonates.
Definitely. And think about where online. The source notes many direct care workers, not RNs necessarily, are often under 35.
Okay, so where are they?
Instagram, YouTube, TikTok. You need to be creating content there.
Yeah.
Engaging stuff with clear links back to your website or job platform, obviously.
Right, meet them where they are. The source also mentioned hiring recruiters, but noted smaller agencies might prefer internal approaches.
Yeah, it's an option.
Yeah.
But the main point was, even without a big budget or an external recruiter, being creative and consistent online and offline can improve recruitment.
It takes effort, but it's doable. Okay, so we've covered retention foundations, recruitment tactics.
Yeah.
But there's another big piece the source dives into: mentorship programs.
Yes, a really powerful tool, not just for cutting turnover, but for building a better workplace overall.
And the stats are pretty stark on turnover, right? Bureau of Labor Statistics?
Yeah, healthcare support roles.
Yeah.
Average turnover around 43%. Huge. Driven by emotional exhaustion, feeling undertrained, lack of support.
Which hits patient care, team morale, the bottom line.
All of it. But then you see research, like from Nursing Outlook, showing good mentorship programs can cut that turnover by up to 50% in the first year. That's massive.
50%. Wow. So what is it about mentorship that makes such a difference?
It's about belonging, resilience, professional development. It goes beyond just the technical skills you learn in orientation. It's support, connection, nurturing the whole person.
Tackling the emotional side of the job, the burnout risk.
Yeah.
Things you learn from experienced peers.
Exactly. The source had the great example, James, the experienced hospice nurse, mentoring Sarah, who was struggling with end-of-life conversations. He used his own experiences, role-playing, built her confidence, and then she started mentoring others, that ripple effect.
That's fantastic. And the financial side. Replacing a caregiver costs thousands, right?
Easily $2,500, $4,000, the source estimated.
Okay.
So mentorship isn't just nice to have, it's a smart financial move. Investing in retention pays off.
Okay, so if an agency is sold on the idea, how do they actually build a mentorship program? The source laid out 5 steps. First step, diagnose the problem, set clear goals.
Right. You got to know what you're trying to fix. Look at your turnover data, exit interviews, staff surveys. Are people leaving quickly? Is there a disconnect between shifts? Are part-timers feeling left out? Find the patterns.
And then tailor the program based on that data.
Exactly. If exit interviews mention struggling with family conflict, focus mentorship on communication skills. If burnout's high, pair people with mentors strong in stress management. And importantly, ask your current caregivers, what did they need when they were new? Focus groups, surveys, get their input.
Ground it in reality. Okay, step 2. Design it around the caregiver's actual lives. Needs to be flexible, right? Home care is unpredictable.
Totally. A rigid program won't work. So first, think about matching. Compatibility over just seniority. Use intake surveys values, communication style, specialties. Match that dementia care newbie with a dementia expert mentor.
Makes sense. Smart matching. What else for flexibility?
The structure itself.
Yeah.
Maybe require monthly check-ins, but let the pair decide how. Video call, walk, coffee, whatever works. Give them discussion prompts to guide things, but let them adapt.
Okay. And training the mentors themselves.
Crucial. They need active listening skills, how to set boundaries, maybe trauma-informed communication. Role-playing difficult scenarios can really help prepare them. It's a big role.
Definitely. Okay, step 3. Foster psychological safety and trust. Mentees need to feel safe being vulnerable.
Yes. Mentors can help by sharing their own past struggles. Makes it feel less like judgment, more like shared experience. And create chances for informal bonding. Maybe mentor lunches, not focused on work, just connecting as people.
Building that human connection. Step 4. Measure the impact and iterate. You need to know if it's working.
Right. Track the numbers, retention rates for mentored versus non-mentored staff, but also the qualitative stuff, skill development via evaluations, emotional well-being via anonymous surveys.
And use that data to adjust.
Absolutely.
Yeah.
Maybe mentees still feel isolated. Add group sessions, mentors feeling burnt out, reduce their load, or give them more support. It's a living program, always improving.
Constant refinement. And the final step, number 5, celebrate and sustain success. Keep the momentum going.
Yes. Make mentors' contributions visible. Newsletters, bonuses, maybe prioritize them for leadership training. Show their effort is valued. And celebrate mentee wins too, certifications. Great patient feedback. Share it widely. Reinforces the program's value.
Makes it part of the culture. And this all loops back, doesn't it? Better retention, yes, but also better patient care.
Absolutely. Confident, supported caregivers provide better care. The source mentioned a study showing a 25% jump in patient satisfaction scores in places with mentorship. It's all connected.
Wow. So investing in your caregiver's growth really does make you an employer of choice. Eases recruitment, builds a culture.
A culture centered on caring for the caregivers, so they can provide the best care. It's a positive cycle.
It really is. Well, this has been incredibly thorough. We covered those retention foundations training, HR, culture, tools, then recruitment strategies, internal, community, online, and finish with the deep impact of mentorship.
Yeah, and remembering how it all links together. Good retention makes recruitment easier. Supported staff means better care. It's not separate silos.
Definitely not.
This deep dive was brought to you by our friends at Alora Healthcare Systems.
They're a leading provider of home health software solutions.
Their platform is designed to help CEOs, executive teams, and caregivers manage all the complexities of home care.
All those moving parts.
From referrals and patient care to productivity finances, personnel and compliance.
They've got it all.
Head over to alorahealth.com or give them a call at 1-800-954-8250 for a free software assessment.
So, the final thought for our listeners, maybe consider which of these strategies could make the biggest, quickest difference in your agency right now? And bigger picture, how can really focusing on caring for your caregivers transform your whole organization and the care you provide?
Lots to think about. It's ongoing work, always room to improve.
Absolutely. Thanks for joining us for this deep dive. We'll catch you next time.